All right, good morning. Welcome back to Daybreak. It's now 5 minutes before 7 a.m. Shortly, we'll be speaking to the Member of Parliament for Seme constituency, that is Dr. James Nyikal, who is also a former Principal Secretary, or actually Permanent Secretary at the Ministry of Public Health. He'll be telling us about what he thinks can be done differently in administering the donor funds that have been coming to the ministry. But first, let's take a look at where we are in terms of the coronavirus disease. If you can take a look at the numbers that in Kenya now, we have 465 infections confirmed. These are positive cases that have been confirmed. And out of those, 24 people have died, 167 have recovered, and therefore the active cases are 274. So far, 23,780 the people that have been tested, and out of those, 465 have returned with positive results. Now, the next one to look at is the Kenya's worst week, because you were told that yesterday we recorded or registered 30 new coronavirus cases, and obviously now that takes us to 465. The week began at 363, so the difference there should be 112. Yes, and the new deaths have been 10 over the past 1 week, and that is the highest in the history of coronavirus here in the country since it began in March. That is March 13th. Then, if we are to look at tracking the weeks, the first week of coronavirus, the first 10 days, we registered some 15 cases. In the second week, we registered 27 cases. Week 3, this was the worst week if you are to compare with what we have now. 100 cases. This is at the end of March, getting into the first week of April. And then on week 4, we registered 55. That was a dip. Then week 5, we had 73 cases. Week 6, 85 cases. And now week 7, 110 cases. Now we are in week 8. We don't know where those numbers will be. And to speak to us this morning is Dr. James Nyikal, who is joining us from, I don't know where he is. He'll tell us whether he's in Nairobi or in his home constituency. Good morning, Dr. And how are you feeling?
Good morning. Good morning. I'm in Nairobi.
Great. So he's in Nairobi. Now, of course, you're speaking to you first because you're a doctor. Secondly, you're a member of parliament and also a member of the health committee. But thirdly, you served as a principal secretary at the health ministry back in the day. So when you look at the war against the coronavirus since the 13th of March, or even as the year began, when preparations began, what do you make of it, and why would you rate us in terms of the response you've seen so far and the cases and the trends?
Well, I think so far what we did at the beginning, we started a bit too slowly, and you remember what really sparked us off was that issue of an airline from China, and soon afterwards we had the first case. And I think